يا أيها الذين آمنوا اتقوا الله وقولوا قولا سديدا يصلح لكم أعمالكم ويغفر لكم ذنوبكم ومن يطع الله ورسوله فقد فاز فوزا عظيما إنا عرضنا الأمانة على السماوات والأرض والجبال فأبين أن يحملنها وأشفقن منها وحملها الإنسان إنه كان ظلوما جهولا ليعذب الله المنافقين والمنافقات والمشركين والمشركات ويتوب الله على المؤمنين والمؤمنات وكان الله غفورا رحيما.
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. أشهد أن لا إله إلا الله وحده لا شريك له وأشهد أن محمدا عبده ورسوله. اللهم صل على محمد وسلم. We give all praise to Allah Azza wa Jalla. We thank Him for His countless blessings in our lives. We testify that only He who deserves our worship, and the Prophet Muhammad sallallahu alaihi wasallam is indeed a prophet of Allah. May the continuous blessings of Allah be upon him, members of his household and companions. I greet you in the best form of greetings, and may the peace and blessings of Allah be upon you by saying Assalamu alaikum wa rahmatullahi wa barakatuh. Subhanallah walhamdulillah wa la ilaha illallah wa la akbar wa la hawla wa la quwwa illa billahi al-aliyyil azim. Give all praise to Allah Azza wa Jalla for reserving us, for preserving us, for sustaining us on this path of Al-Islam. And that is to welcome you unto all you who believe, a special broadcast reaching you from the platform of Old Kent Road Mosque and Islamic Cultural Center. Alhamdulillah, I'm so excited, so happy to be part of this project. Alhamdulillah, we've been touching lives and we still have a lot of grounds to cover. Today is a very special day in the sense that we are looking at something very, very peculiar. Peculiar in the sense that while I was growing up, I was brought up to believe that, I grew up to believe that there are some roles, some information for gender. There are gender-specific information. But I was brought up to know that a role is a role that could be played by virtually everyone. Even if you're not directly involved in it, in one way or the other, you will definitely be instrumental to other people's understanding of it. And that is the topic for discussion today. Have I told you anything special? Don't worry, we'll get to know more about it. This is just to say a very big thank you, Jazakumullahu khaira jaza, to everyone who have been contributing greatly to the Rebuild project. And inshallah, on the 4th of December, inshallah, all roads lead to Manchester City. Yes, when we shall be having a special fundraising for event for Old Kent Road Mosque and Islamic Cultural Center. Thank you very much for your beautiful donations. We are still waiting for those pledges. We pray Allah Azza wa Jalla to bless all of you. Allahumma amin. I still have a couple of more information, but before then, I think it's proper for us to start off with a recitation from the glorious Quran. One of the students of Markaz, Old Kent Road Markaz, Sister Walayat Abdurrahim, will be the one to lead us in the recitation. After that, a few more information before we move into the project proper. Sister Walaya, are you ready? Are you there? Bismillah. Wa alaikum salam wa rahmatullahi wa barakatuh.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم اقتربت الساعة وانشق القمر وإن يروا آية يريدوا ويقولوا سحر مستمر فكذبوا واتبعوا أهواءهم وكل أمر مستقر ولقد جاءهم من الأنباء ما فيه مزدجر حكمة بالغة فما تغني النذر فتولى عنهم يوم يدعو الداعي إلى شيء نكر خشوعا أبصارهم يخرجون من الأجداث كأنهم جراد منتشر مؤسئين إلى الداعي يقول الكافرون هذا يوم عسير كذبت قبلهم قوم نوح فكذبوا عبدنا وقالوا مجنون وازدجر فادعى ربه أن مغلوب فانتصر ففتحنا أبواب السماء بماء منهمر وفجرنا الأرض عيونا فالتقى الماء على أمر قد قدر وحملناه على ذات ألواح ودسر تجري بأعيننا جزاء لمن كان كفر ولقد تركناها آيات فهل من مدكر فكيف كان عذاب ونذر ولقد يسرنا القرآن للذكر فهل من مدكر كذبت عاد فكيف كان عذاب ونذر إنا أرسلنا عليهم ريحا صرصرا في يوم ناس مستمر تنزيع الناس كأنهم أعجاز نخل منقعر فكيف كان عذاب ونذر صدق الله العظيم.
MashaAllah. Alhamdulillah Rabbil Alameen. Alhamdulillah. We pray Allah Azza wa Jalla to bless you. Thank you very much, Sister Walaya Abdul Rahim. I almost said Dr. Walaya. MashaAllah. May Allah make it easy. Even Professor. Inshallah. May Allah make it easy. Alhamdulillah Rabbil Alameen. While we are still waiting for our guests, inshallah, our guest speaker today, I have every pleasure to welcome you all once again to this. I pray Allah Azza wa Jalla to bless you, bless your parents, and bless your teachers. Allahumma ameen. May Allah Azza wa Jalla make the Quran light for each and every one of us who listen to it too. Allahumma ameen. Well, a very quick one again regarding projects today, inshallah. I'm pleased to inform all of us here that by the grace of God, there are openings at the markaz. If you want your kids to learn about Islam, learn the recitation of the Quran, understanding of Islam, and practice of it, inshallah, there are openings at markaz. Please ensure you send your kids, your children to markaz. We pray God Almighty to make them Qurata Yun, soothing to our eyes. Allahumma ameen. With that, I think it's good for us to quickly move to the next step. My name is Abigani Olawale Hassan, and I have the pleasure to tell us today, inshallah, that standing in for Professor Mashood Adebayo Baderi, I have Ramadan, Sister Rashida Adeyinka. Over to you. Bismillah, ma.
Assalamu alaikum wa rahmatullahi wa barakatuh. And thank you very much for starting us up on the program today, Brother Wale Hassan. And thank you very much to Sister Walaya for that beautiful recitation of the Quran. May Allah accept it from you and your parents, and every single one of us that have listened to it. May Allah bless us by listening to the words of Allah. And yes, it's quite strange today because I'm standing in a very big shoe of the prof, as well as all my able fathers, Imam Ajikole, Brother Shams, and everybody that I have to stand in today. I guess maybe, I'm not sure if it's a coincidence that I'm having to stand in today because of the nature of the topic we're talking about, but believe me, that's not the reason. The reason is just that the prof is not available at this moment, and he would be joining us any moment from now. But inshallah, I do hope that what we're going to be talking about today is something that is very important, that is not just gender specific, but it is something that every single one of us should know about, because it's something that is a marker of change in the life of not just the women, you know, that pass through the issue we're going to talk about today, but also a marker in the life of the people around them, because this is actually a life-changing occurrence in a woman's life, and which invariably affects them and also affects people around them. I'm not an expert to talk about that, and that's why today on OU We Believe, we have decided that to bring somebody that we believe is ably qualified to talk about this topic and to enlighten us, as well as, you know, put us through. And I don't think it's even a coincidence that we will dedicate a session to talk about something that's just related to women, because even Allah himself in the Holy Quran dedicated a whole chapter of the Quran to women, just because, you know, we impact the world in different ways. Men are also very important, but, you know, there's always that special nature of the women. And that's why today, inshallah, we hope to have Dr. Fauzia. I don't know, is she here with us already? Please, if you are, kindly raise your hand so that we can put you on the panelist link. I think she is. I can see somebody raising their hands. Yeah, perfect. Perfect. Thank you very much. Yeah. So inshallah, today, to the person that is going to be talking with us will be Dr. Fauzia Taiwo Olajumoke Aderolu. She is a GP partner at Robert Frueh Medical Center, Wingford, Essex. She is a member of the Royal College of General Practitioners or Practitioners. I'm not sure. You're going to have to tell me about that. Maybe it will be another grammar to add in my archive. Oh, sorry, in my dictionary. So yeah, Dr. Fauzia, inshallah, alongside her professional calling, she is able to combine her role as a wife, mother, and among leadership of the community, as she recently served a term as the Amira of the Muslim Family Awareness Forum. She is sharing her informed thoughts on a less talked about but very important female well-being topic, and that is menopause. So inshallah, today we'll be talking about menopause. I'm sure a lot of us, maybe some of the men, would want to say, oh, how does that relate to me? It definitely relates to you, because if you don't have a daughter, you have your wife, you have your sisters, you have all the female members, you know, that you have contacts with, who at one point or the other will go through this process. And like I said, for those of us who are nearing that age, I'm not even sure. I think today I'll get to know if I'm actually nearing that age of menopause. Dr. Fauzia, I hope you're here. Please kindly let's see you. Yeah, Jazakumullah khairan. Good. Assalamu alaikum.
Alaikum assalam wa rahmatullahi wa barakatuh.
Yeah, alhamdulillah. Thank you very much for joining us. I've introduced you, I know you are much more than that because you are my sister and I know you very well. But, without wasting much of our time today, this is a very important topic and we'll just give you 25 minutes to talk to us about this topic, menopause. And then after then we'll take some breaks and then we'll come back and I'm sure we'll have a lot of questions and conversations around this topic. So inshallah, I'll call on Sister Dr. Fauzia to take us through this, the next 25 minutes.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam.
Yeah, just give me a minute. I want to try and see if I can share my screen.
Okay, so just as we're waiting for Dr. Fauzia, can I just inform every one of us here to please share this link for this conversation. Trust me, it's a very important conversation that nobody wants to miss. And we need to now use this opportunity to give everyone, an opportunity to hear and to learn. And also, of course, that the OU Who Believe is here for our enlightenment, to support our communities in every way possible. So please do share and also invite people to all the social media platforms. As you're watching this, it's on Facebook, it's on YouTube, it's on Twitter. And, even if you're not able to join on Zoom, you should be able to join on any of those platforms. And Dr. Fauzia, are you ready? Okay, let's just take a quick break while we're waiting for Dr. Fauzia.
Is the soul of the Muslim community. It is the hub of life-giving and spiritually fulfilling activities, feeding of people on the street, youth camp, empowerment of women, and care for the elderly. The timely and effective COVID-19 intervention on OU Who Believe, our online lecture series, is a masterpiece. The Visit My Mosque project breaks barriers. We take pride in the blend of our mosque users who cut across color, gender, age, and social differences. Academic, moral, and spiritual education is catered for at the Markaz. The 5 daily prayer, Jum'ah service, our healthy living, counseling, marriage, naming, and burial arrangements are top quality. The Old Kent Road Mosque and Islamic Cultural Center, where we do these and more, is now in ground zero. Our faith in Allah and your great contributions can make the 6-story building a reality. Please donate and encourage others around you to donate towards the rebuilding of the house of Allah. May Allah bless you abundantly. Ameen.
Bismillah, go on. Were you not able to share?
Can you see my screen?
Not yet.
Okay. I'm not sure why that is. Download.
If you're having any challenge with it, maybe you could possibly send it to Brother Hassan to share for you.
Okay.
Yeah, you can just send it on WhatsApp or something.
Okay.
Assalamu alaikum wa rahmatullahi wa barakatuh. When we help to build a mosque, we are not just spreading our deen in this world. The Almighty Allah will also reward us with a house in Jannah. Here is a call from the entire Nigerian Muslim community in the Northwest and West Midlands of England, United Kingdom, inviting you to be part of the rebuild project of the Old Kent Road Mosque, Southeast London. Inshallah, we are hoping to raise £500,000 for the rebuild project. May Allah provide for us all. The fundraising will take place on Sunday, 4th of December 2022 at the Irish World Heritage Centre, number 1, Irish Townway, Chitham Hill, Manchester, M8OAE. Time 12 p.m. to 4 p.m. Participating organizations include Nasrullah Wafatu Islamic Centre, Manchester, Al-Fatih Al-Qarib Islamic Society of the UK, Manchester, Organization of Al-Ahbab Rasul, Manchester, Al-Musinun Islamic Centre, Manchester, Salam Sisters, Manchester, Nemab Welfare Trust, Birmingham, and the Nigerian Muslim Association, Coventry. Host, Muslim Association of Nigeria, UK, Old Kent Road, London. Donations are accepted in major currencies: pounds, dollars, euro, and naira. We also accept Quality Asana from interested donors. It is an interest-free loan given towards the mosque project. We have reliable, competent, and credible professionals who will stick to the terms of the loan without default. For more inquiries, call the regional coordinator, Imam Muniru Ajikonle Moyosore Hussein, on +447 476 601 701. Allah promises to reward every act of ibadah done for His sake alone, including the building of a mosque. We will be expecting your generous contributions, donations, and Qadi Asan. May Allah reward you as you do so. Ameen.
Yeah, alhamdulillah. That's just a call again. We're all super excited about the program, coming up this weekend. And I do hope that we'll see a lot of you at that event and possibly invite friends, family, and, we need to see that mosque, standing, because it's for all of us. We all own the Old Kent Road Mosque and Islamic Cultural Center of the Man UK, and we would expect you at that event this weekend. So Dr. Aderolu, I will hand over to you now, and inshallah, I'm sure your screen, the screen will be shared. Yeah. Assalamu alaikum. Go on.
Alaikum assalam. Has he got it?
Yes, it's got it. It will share it.
Okay.
So maybe you can start with your introduction. Yeah, you can go on. It would share the screen.
Okay. All right. A'udhu billahi minash shaitanir rajeem. Bismillahir rahmanir rahim. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuhu. So this evening, I will be talking to us about menopause. And basically, this is a condition that affects women in their older age. It is the period in a woman's life when she stops to have a period. And it happens when she stops releasing eggs from the ovaries. This could be as a result of a natural cause or as a result of other reasons, such as following surgical removal of the ovaries or following some certain treatments that kind of makes the ovaries stop working. And as a result, she stops having the hormones that result in periods happening. Most women in the UK have their menopause between the ages of 45 and 55, with an average age of 51 years of age. In some women, menopause can happen a bit earlier than these ages, but for majority of women, it's between the age of 45 and 55. However, for women below the age of 40, if they stop having their periods, then that is not menopause. That is a condition that is known as premature menopause or premature ovarian insufficiency, which means their ovaries have stopped producing eggs earlier than it should be. Sometimes the cause is known, sometimes it's unknown. And usually when a woman gets to that stage, there's not a lot that can be done to bring back her fertility. The time, the time before, okay, the time before the last period. Yeah. So the time before the last period when the estrogen levels is falling is called the perimenopausal time. And this can last between few months to several years. For around half of women, physiological and emotional symptoms happen this time. So the period when the time or the duration when the period of a woman starts to slow down, either she has less bleeding or the time between her periods get reduced, is called the perimenopausal period. And that duration of time could last several months or years. And during that time, a woman will be experiencing physiological or emotional symptoms and emotional symptoms during this time. Next slide, please. So women during menopause, they present with so many symptoms. Can you go to the next slide, please? So the most common symptoms that women present with is hot flushes. Suddenly they start to feel hot, they start to feel heat in their body. Sometimes they wake up with night sweats as a result of the overheating, and this could result in sleep disturbances for women. Women can experience vaginal dryness, and as a result, sex becomes more painful. They start to lose interest in having sex. They start to have low moods. They start to become anxious. They don't know what's coming next. They don't know what's happening to them. Sometimes there's frustration, there's anger, there's depression. And these are the emotional aspects that come with menopause. Some women will experience joint pains, muscle pain. Some will have recurrent urine infections. Some will even have trouble with controlling their urine. They find out that, oh, they can't make it to the toilet, or when they cough, they're leaking a bit of urine. Some women will experience hair loss, brain fog, they can't think, there's poor concentration, and all sorts of symptoms. To be honest, most patients that I've seen, they even come with symptoms that are outside of this, although these symptoms can be attributed to menopause, but it's not always the case. So for example, if you have these symptoms and your period are still quite regular, they haven't changed in pattern, and you have a cluster of these symptoms, then you have to be looking elsewhere, because your problem may not be necessarily menopause. So menopause mimics a lot of other problems that are not necessarily menopause. So it's important to be able to look at the time and to be able to study your periods and see, has there been any change in the pattern of my period of late, before you start attributing these symptoms to menopause. Can I have the next slide, please? So it's important to realize that every woman experiences menopause differently. Some women will go through menopause without blinking an eye, and some women will go through menopause and they really, really struggle. They can't understand themselves. They become someone different. The husband will say, oh, this is not the person I married. Their workplace will be wondering what's wrong with this woman, or maybe she's having issues at home. The children don't understand their mom. Even the woman doesn't understand herself sometimes. So it's a very trying and difficult period for some women. Some women's period symptoms will be mild, while some will be very distressing and severe. And some women will go through menopause without needing any support, while some will go through menopause and needing a lot of support, i.e. from the home, the husband understanding that this is what the wife is going through, the children, the workplace, understanding that this is what this woman is going through. Now, next slide, please. Right, so these are the different perspectives from different women with regards to menopause. One lady, she's 56, she said, since menopause, I always get sick, I easily get fever, cold, flu, It's almost since 2 years now. And every month I need to go to the clinic to say I'm feeling unwell. Last month I felt faint and I've done my medical checkup and everything is fine. I don't know what is happening to me, you know? So sometimes even the woman does not understand herself. Another woman has said, you know, for her menopause, she's so happy, she's positive about it. It means she's not gonna fall pregnant. She doesn't have to worry about taking pills. She doesn't have to worry about missing her salat, her fasting. You know, she can do what she wants. So that's another woman's perspective to menopause. And another woman would be like, oh, I can read the Quran. I can, you know, start memorizing the Quran or, you know, set targets for myself without my period messing around with my routine. So it's very different for different women from different perspectives. But what I want to emphasize that we all as women or as a community should have a positive attitude to menopause and be able to recognize it and be able to support people and understand what they're going through, that it's not within their control. It's just that that is how their body perceives it, and that's how their body is responding to it or reacting to the lack of estrogen, which is the hormone that is deficient or is lacking during menopause. Next slide, please. So different people have different coping mechanisms. Some say they when they take supplements like Primrose, vitamin C, calcium tablets, it does help them. Those going through emotional problem may have to go through to take some tablets like mood stabilizers to help them. Some women will have to go through like CBTs too. Some women some women will have to go through like some counseling to help them understand what they're going through and how to express themselves and be able to cope with it. Some women will turn to meditation, some go to gym, some find a new hobby, you know, some make lifestyle changes like light clothing, having the fan on, opening the windows, you know. So I think women just make different adaptations to how to help them cope with what they're going through. And I have the next slide, please. Right, so how do you know if you're going into menopause, or how do you know if you've reached menopause? Like I said at the start of the presentation, for most women, they will go into menopause between the age of 45 and 55. For women below the age of 50, they need to have stopped having a period for at least 2 years before they deem to be clinically, before they're said to have gone into menopause. And for women above 50, then a year after having no periods, then you know that you've gone into menopause properly. If you start to have a period between that time, say if you're 47 and you have missed your periods for say 18 months, then you have another bleed, then you have to start counting again. So it's not cumulative, it's from the actual last period that you've experienced. And then a few range of women under the age of 45, if they're having their periods reduced in terms of frequency or quantity, and they're having some of these changes, then it might be that they've started to have perimenopausal changes, and which means that they are having months when they have the hormones adequate and they have other months when it's not adequate. And as such, their mood can be all over the place as well. And for such women, they will need to have a blood test to confirm if they're actually going through their period or not, through their changes or not, or if they're actually gone into proper menopause. And like I said again earlier, anyone less than 40, if you're having any of these symptoms, especially with your periods becoming irregular, reduced, or no periods at all, then it's completely a different ball game. And the duration for menopause can last between 4 to 7 years on average, but you do have people who still have perimenopausal changes going up until 12 years. So you have a period, you don't have a period, is start, stop, start, stop. But again, this is not something we see frequently. Next slide, please. So I've explained this earlier: healthy lifestyles, regular exercise, diet, making sure you maintain a healthy weight, good work-life balance, hydration, sleep hygiene, yoga, dhikr, meditation, staying active, and most importantly, having a positive mindset. So to menopause, these are all coping strategies that people can use. And then lastly, there are medications that can help women to go through some of these difficult times that they're having. And these medications are called HRT, which stands for hormone replacement therapy. The first one is the topical ones, which are things that can be applied on the skin. They contain the estrogen, which is one of the hormones that is the main hormone that is deficient. Estrogen can also be applied as a patch or as a gel. It can come in forms of tablets. And then there are tablets that need to protect the lining of the womb while you're on estrogen, except for women who have Mirena or women who have had their uterus taken out, because the reintroduction of estrogen into the body starts to reactivate all the cells and all the structures in the womb, the lining of the womb, around the genital area and all over the body. So part of the way to protect you from having new bleeds or actually having too much of cells regenerating inside the lining of the womb is by the use of the Mirena or by use of regular tablets that will control the lining of the womb. So next slide, please. Right, so HRT has pros and cons. While it is good in restoring a lot of the physical and emotional difficulties that women are going through, it also comes with its own backdoors. There are risks that come with HRT. There's some slight risk of breast cancer, risk of uterine cancer, ovarian cancers, blood clots, strokes, but it doesn't come with all of the HRTs, like the vaginal tablets, which mainly acts in the female genital area and help women with symptoms of dry vagina, recurrent urine infections, or poor bladder control. If you're just using the vaginal estrogen, which comes usually as a pastry or as a gel, then this risk did not apply to you. If on the other hand, you're going on the tablets or the gels and patches that you apply and go all over the body, then this risk applies. Okay, so studies have shown that for women who go on HRT, for the first 5 years, this risk is very minimal. And for that reason, HRT is mainly licensed for 5 years. If after 5 years, most of this risk will increase, okay? For the first 5 years, women have to go through some assessment to see if they're suitable for the HRT. So for people with like family history of breast cancers or that have had previous breast cancers, then it would not be advisable for them to go and do HRT, because then obviously they are exposing themselves to extra hormones that can cause a reoccurrence of the breast cancers. Or for those that are already predisposed, then they're exposing their body to long-term estrogen that can, increase the risk of having breast cancer. But the uterine cancer is highly unlikely if you use the right HRT, for the simple reasons that if you remember, the first explanation was you can use the Mirena or you can use some tablets that will help to regulate the lining of the womb. And for such reason, it's highly unlikely that women would develop uterine cancer from taking HRT. Ovarian cancer, again, some ovarian cancers are hormone related. So if you're already predisposed to having it and you expose yourself to the estrogen, then you run the risk of having ovarian cancer. It may not be the cause, but it will accelerate, the risk of having it or the tendency to have it. And then with any hormonal treatments, including things like our oral contraception. They have risk of increasing risk of blood clots. So patients who have had blood clots before, like DVTs, blood clots in the legs or in the lungs, then those patients, it will not be recommended for them to go on HRT. And obviously, because of the increased risk of blood clots, that can send blood clots to the brain, and that can result in stroke in certain women. But again, if we look at that cohort of patients, the risk of breast cancer is low in that age group. The risk of stroke is low in that age group. The risk of uterine cancer is low in that age group. So if anyone is going to go through the course of having HRT, then you want to use the least effective dose and for the maximum period of 5 years. Because again, like I said earlier on, I explained earlier on, the menopausal symptoms usually resolve within 4 to 7 years. So usually on an average of 5 years, most women should have gone through the worst part of their menopausal symptoms. Next slide, please. Okay, so there are alternatives to HRT. It's not all about hormone replacement therapy. For women who are scared to go on it, or for women who, for medical reasons, have been advised that they are at additional risk if they go on HRT, there are tablets that can be used to control some, not all of the symptoms. Like the clonidine is a type of blood pressure tablet, but it can also be used to control the hot flushes. Some herbal medication have been reported to be effective in controlling some of the HRT or some of the menopausal symptoms. But however, there are concerns about their safety because there's not been enough studies or scientific studies to see the long-term effects of these herbal supplements. Some antidepressants can help for women who are struggling with their moods, anxiety, depression, poor sleep. Some antidepressants can help with them, and they don't necessarily have to be prescribed as antidepressants. They're going to be prescribed for a different reason, which is for menopausal symptoms. Again, things like counseling, CBTs can be helpful for patients going through anxiety and depression during their menopause. And vaginal lubricant can also help with vaginal dryness. And they can be simple things like Vaseline or a preparation called Silk, which is available over the counter. Next slide, please. Right, so menopause and Islam. The physical and emotional changes of menopause, they vary from women to women. And although there are some strong correlation between social influences and menopause transition, for Islamic women, menopause presents a lot of challenges with additional religious laws important to daily lives. Like you can't really predict when your period is going to come. You've got your mood swings. You've got the time maybe when the children are leaving the house. So that emptiness comes in. You've got your career ahead of you. You've got the pressure of the husband not meeting its needs. So it's important for us as women to recognize what we're going through and speak to our spouses, speak to our employers so they can understand that this is what we're going through. And that way they can give you some support and understanding that this is what you're going through. And it's very important for us as women to know that we're not alone, that we need to let the people around us support us as best as they can. So yeah, next slide, please. Right, so it is impossible and unethical to attempt to compartmentalize all Islamic women into a convenient category. So for a woman living in Riyadh, she may as well present with menopause, and that society's understanding of menopause and how to handle things may be different. And for a woman living in Nigeria is different, for a woman living in the UK is different, because of the stereotypes, the prejudice, the support networks. Like I know, like in Nigeria, women don't complain a lot about it because they're very busy. Here in the UK, people feel isolated already, and then to go through this by themselves, it's quite hard. So we must not start to judge or compare ourselves with other people. We must try and see each woman as an individual and give the support that we can. And if we look at Islam recognizes that this is the trying period for women. Islam recognizes that after a certain age, women go through menopause, and at that stage, they're no longer in the childbearing years. If I remember very well, in Islam, like the woman who has gone to a certain age, they said you can actually put away your big jalabias and still dress decently. And I think when we look at it in an Islamic context, it's like Islam acknowledges that it might not be convenient for that woman to have those heavy clothing on because of this hot flushes, night sweats. So it's important for us to realize as women or as Muslim women that we do have an obligation to engage in our religious duty fully, and we have our duties to other people in the society and in our homes, and to be able to try and help ourselves to be able to cope through this phase that we go through in life. Next slide, please. Okay, so that's the end of the presentation, and I'm happy to answer any question. Jazakallahu khairan.
Thank you very much. That has really been very enlightening, and it's good to listen to. I was saying at the beginning of the program that I'm not sure if I've reached my menopause period yet. It does look like I have. So I don't know if I have any of those symptoms, or maybe some of the things that's been happening is actually related to that. But it's really very I'm really very grateful to you for this session and for highlighting all those issues. So like we've listened, and we can all see the issue of menopause goes beyond it's being about the women. You know, you talk about the physiological and the emotional symptoms, and I'm sure we'll have a lot of questions around what the things you have said, and possibly people wanting to seek clarification, and particularly members of our families, you know, that are relating with women, and when they're passing through this sort of experience. So inshallah, we'll come to the question and answer very soon. But just before then, we'll quickly take a break from the control room. The control room is calling for the control room to, you know, give us a break.
My parents chose to name me Old Kent Road Islamic and Cultural Center as a baby, and when the time came for me to start my family, my daughter was also named at this masjid.
Same as my story, I was also born and named there. I attended Maracas and used to play football after classes with my mates.
The Old Kent Road Mosque and Islamic Cultural Center, MAN UK, is a community where all Muslims enjoy the bond of brotherhood and the sweetness of sisterhood.
Old Kent Road Masjid has played an important role in my spiritual and social development, and that of my young family.
It is a home, a place of solace for everyone, especially the Muslims of African descent living in London, United Kingdom.
This is a heritage we treasure and must preserve for the next generation. We need you to make this dream come true.
Kindly donate and encourage your family, friends, and loved ones to contribute towards the rebuilding of our mosque.
May Allah bless and reward you abundantly. Allahumma Ameen.
Please help build our mosque.
Yes, please help build our mosques. That is the appeal we're running. Join us this weekend at Manchester for the fundraising special program. It's actually December 4th. I'm sorry. I thought I said this weekend. Sorry about that misinformation. So it's December 4th. So I guess it's because I'm in a hurry for us to do this and get the money. And as you know, we say all the time, and as the prof is always saying, this is something that we all have to do together, and you can never be tired. We are seeing this dream with our eyes opened. I mean, if you walk on the, if you go to the Old Kent Road at this moment and you see what has been done already, you will see that this is a dream that we have to make into reality, because it is a dream we can see with our eyes very wide open, to have that edifice where it is at that point, and for us to have ownership as a community is something that is really, really great. And I'm sure every single one of us want to be part of that. And that is why I would not refuse to follow to actually make sure that I'm doing what the prof has asked me to do exactly. And at this point now, you know, if the prof was here, is going to be talking about the Buy a Soft initiative that we started a couple of weeks ago. So we're not going to stop it today. And that's why I'm going to call on everyone. Look at this. Isn't this beautiful? Now imagine when it is completed and how it's going to look like. And for you to proudly say that I am part of making that happen. So that's why I'm going to let us do maybe in the next couple of minutes. If there is anyone that wants to start off, the £1,000 campaign that we do weekly for buying a SAF. Don't say because Prof is not here, you're not going to make the donation. In fact, I think I want to challenge. I'll start off by saying I'm going to give £50 for today. So if there is any other person that wants to follow up in my stead, please kindly raise your hand. I've got Alaja Alayaki. If you unmute yourself, please.
Thanks for the good work.
Yeah,
I'm donating £50.
Oh, thank you very much. So that's it. We've started. So we have £100 now. You can say, okay. Yeah, and of course, you know what is happening on the 4th. We're going to be having the £500 initiative. That is, we're going to £500,000 campaign that we're going to be running in Manchester, and we can't wait to get this done because it will be a great step forward for us. So I'm going to call Alhaji Mustafa Akande.
Assalamu alaikum, Sister.
Alaikum salam, sir.
I'm not very supportive. I'm also £50.
Thank you very much. Alhamdulillah. Thank you very much. Better. Thank you. Let Emma Thank you very much. No, nothing is too small. Everything Allah will put barakah.
Inshallah.
Jazakumullah.
Okay.
Yeah, so now we have 750 left. I've got £50 donation from my darling sister Falila Talabi. Thank you very much. So we've got 250 now, and we need 750 to go. Please let us do this stuff today quickly, so that we can let Prof know that we're taking it on, and we've taken up this challenge, and we're going to make it happen. So who's going to go next? We've got 250 at the moment. There is 250 pounds. So yeah, so there's another Andres. Is it my sister wanting to join?
Yes, you need to sit up.
Pardon me? Hello? Dr. Adero, did you say something? Adero.
Yeah, I just wanted to donate £50 as well.
Oh, thank you. That's 300. We're almost there. Just 700 left to go. We're almost there. Who's going next? Who's gonna go next? Yeah.
Yes.
Okay. Anyway, you know what? Just keep it coming. Okay, Sister Mulkat, please.
I
will also give £50, Sister Rashida. Inshallah.
350, yeah, 650. We're going gradually. I mean, we've got how many people here now? Over 55.
Brother Idris need to has his hands up.
Okay, go on, my president. Hello, sir.
Which account?
Oh, where is he? I can't see him. Anyway, Brother Iletu, please. The president, you know, it's so good when you see the president also, you know, being part of this. Alhamdulillah, it shows that.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi.
Yes, I also want to have them £50.
Alhamdulillah, 450. We're getting there. We're getting there. We're going to have this up today, inshallah. We're going to have this up, and inshallah, we're all going to be together. We'll get the reward here in this world, and inshallah, on Yawm al-Qiyamah, we'll also get the reward. So let's continue to donate. We're going 1,000. We've got 450 so far. While we're waiting for people to continue to donate, I think I would like to go to the next item on the program, and that is the financial update. Have we got anyone here to do the financial update? So once we're getting people to donate, we can, you know, quickly have an update about the financial situation. Is there anyone here to do that for us? Do we have our treasurer or somebody from the fundraising team that would like to give us a quick update? Assalamu alaikum. Okay. Yeah. So let's just keep the donation coming, and whilst we're waiting, and we can continue to do that, and we're waiting for someone to give the financial update, we can quickly start taking questions for Dr. Fauzia Aderolu. So if you have questions or you want to make contributions, you know, this is a very important topic for women, and not just for women, for the entire community, for their husbands. We've heard about it, about how it affects even the relationship, how it affects the emotions, how it affects everything. So let's go on. Does anybody have a question? Dr. Aderolu, are you ready for us?
Yeah, alhamdulillah, I'm here. Stay here.
Okay, thank you very much. I guess, well, there's a question I have here, because I'll also be taking the question and answer. Yeah, the question, sorry. So if you have questions, you can put it in the Q&A, or you can raise your hand to ask your question. So one of the question I have here, somebody wanted to know if using birth control pills can lead to early menopause, or any form of birth control.
Right. So yes, birth control pills can result in irregular or delay or even absent periods, especially the mini pills, and that's because of the way they work. The way they work, they thin the lining of the uterus, and they can only thin it so much. So some women, the lining of uterus is not very thick, and it gets to a stage where the pills result in that lining of uterus being so thin or even absent. And for such women, they will just completely stop having periods. So for them, it doesn't mean they have gone into menopause, but they can have stop having periods. So it doesn't result in them having or going into menopause early. Yeah, so that's with the birth control pill. But with the injection, which is given every 3 months, sometimes it can actually knock out the ovaries, because that's part of how it works.
Okay.
But it is meant to knock out the ovaries for that duration of 3 months that you're supposed to be on it. But because we're all different human beings and the way our body responds to medication differs, for some women, just one injection will knock out their ovaries for years.
Wow.
So yes, it can stop you having periods, it can delay, it can knock out your ovaries, and then you can have menopausal symptoms, or you can have delay in conceiving and all that. But that's not really in the true sense of menopause. So I hope I've answered your question.
Okay, we've got a hand raised. Alhaji Atunrashi, please. Atunrashi, please.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
Thank you very much, Doctor. It is good that both men and women are listening to this lecture today. And I'm sure the situation happening with women in particular, coupled with the ignorance of husband, has led to sometimes divorce in the family. But here we are today, we know that men also have what is seen as menopause. I wonder if Doctor will also touch a bit on this. Yes, we do know that men do develop depression and loss of sex drive, erectile dysfunction, emotional symptoms coming in, and those are the physiological and emotional involvement. It will be very great if both sides will understand this, and if they see any changes, they consult their doctor. Could you please, doctor, give us a little bit of that for men, so that we can all share male and female menopause, as it's called? Thank you.
All right, so with men, they don't really call it menopause. I know the term is menopause. You think it's for men as well, but it's actually for women. But yes, truly the hormone, the male hormone, which is the testosterone in men, does tend to decline after some years. There are the most common presentation in men is erectile problems. So they have problems with maintaining erection, they stop having morning erections. Sometimes, you know, it can result in some frustration in the marriage. And again, there is hope for men as well. Certain things like diabetes can predispose people to experiencing these symptoms a lot earlier. People with cholesterol problem, it can result as well because it will reduce the blood flow to the penis, which is the male organ. And also certain medication as well can affect this. So provided you've excluded physical cause and you're in that age group of approaching your 60s, 70s, this is a normal aging process for men. But if it's resulting in, you know, being able to meet your family or married obligation, then you can see your GP to get some help.
Sorry about that, my laptop was special. Thank you very much for that. You know, what Alhaji Atunrashi just said, you know, about the fact that these affecting homes and, you know, it being both ways. You found situations where women at some point becomes really, really very irritable. It gets to points that you have misunderstandings at home. The husband is not able to understand why that woman is being so irrational. You've even had homes breaking up as a result of that. Now, is there any way, that's a question from me before I go to the next question I've got, you know, written here. You did mention about the HT, did I get that right? That's the therapy treatments now, and that have a lot of side effects, as you have said. Now, are there ways to actually deal with these symptoms in such a way that they don't become so manifest or so, you know, disturbing to maybe your everyday living or to your relationships? Are there things you can do to actually manage those situations aside from, you know, going for therapies?
Okay, so thank you. So the first thing is what we're doing, raising awareness.
Yeah,
you know, making women and our spouses understand that at some stage in our life we're going to go through this, and it's not a it's not a life sentence. It's not a bad thing. It's the way we're designed. We're designed to age. The Quran has already told us that we'll be created to be weak, then we'll be strong, then we'll go back to being weak. And this is just a natural process. So I think sometimes accepting that the time has come for our body to have a break from childbearing, from periods, from all of this. So I think firstly, it's important to know that this is what is coming on. This is what is going to happen, and accepting that this is happening. You know, when it comes, this is happening. How will I tackle it? Okay. I'm overheated, then make sure your house is well ventilated. Make sure you have light clothing, avoid the dark clothing, you know? And also just mention it to your husband. You know, don't start becoming irritable when you can actually express yourself and say, this is what I'm going through, or I think I'm going through this, you know? So I think that is the first thing. Being aware, acknowledging it, accepting it, and then dealing with it with each day as it's come. Don't think that, oh, my life is doomed. Because sometimes, like I said, it's a trough. You have 2 months, 3 months, you're struggling. And then suddenly you realize that for another 6 months, you're fine. Because for those 6 months, your ovaries are managing to produce some hormones. And that is enough to keep you going, you know? So for some women, it's going to be like, it's just going to keep going up and up and up and up until the whole perimenopausal thing ends. And then, you know, they get used to it. And some of those symptoms start to taper off. But for some, it's up and down like a yo-yo. So recognizing it and trying to find ways of coping. Healthy eating, exercising, regular shower, choose the right clothing, keep yourself busy, CBTs, you know, which is counseling, all the other things. I think for us, we're lucky as African women. It's not very pronounced, or maybe I should say we're resilient. So I think we're quite lucky, but it's not everyone that will fall into that category. Some people, they're African and they're tough, they're resilient, but they're still gonna struggle. And you have to look at what is best for you. You know, what works for me. If you tried all of these lifestyle things and nothing works, then I'm afraid if you don't have any additional risk factor, then maybe turning to HRT might be a good option for you. Okay, so you can seek professional help and you have regular reviews. Patients that start on HRT, they have regular reviews for the start. After 3 months of starting it, the GP will review you and see how you're getting on and deal with your concerns. And if one HRT is not working for you, you might be switched to another HRT. And when you go into full menopause, then your HRT needs to be switched over as well. And prepare your mind that it's not going to be something that you'll rely on for life. It's usually for 5 years. And because the average age of menopause is 4 to 7 years. So most women, by the time that 5 years has come, you know, they've gone through the worst bit. So don't insist on saying it for other personal reasons, although we have patients who have stayed on it and nothing has happened, but we also have patients who have stayed on it for too long until something happens. And when that something happens, whether they like it or not, we'll have to take them off the HRT. So was it really worth prolonging it for that length of time? But I think when it comes to risk-taking, we're very different. Some people are low risk takers, some people are high risk takers, you know. But at the end of the day, you have to function. You have to function in whatever role you find yourself, and you have to be happy with yourself. So don't suffer in silence. There is medication. All the tablets that we take, they all have risk and side effects, frankly speaking. It's just one side effect. May not be what another person will experience, and you can't really tell who's going to have side effects until you use it. So being aware of those risks is not to discourage us, it's but for us to be aware of them, so that if you are on the HRT, then you be on the lookout for what is abnormal. Yeah. So That's just my
yeah, I guess maybe what I would also like to, as you're talking, I've been reflecting on what you're saying. I guess one of the reasons we're doing this, like you said, is to educate and enlighten people. And when women do get to that stage, it will also be most helpful to have people who are understanding around them, who are able to identify with them, especially their partners, who are able to identify with them that right now it seems this is what is happening, and it makes it easier to take on some of those frustrations that might become from the woman. And I think that's something that is very important that we all should learn from this conversation tonight. And just as we're talking about that, I don't want to forget about my surf fundraising. So I've got 450, there is 550 to go. Please keep it coming. Make that donation. Let's make sure you are able to raise that £1,000 today. And I haven't talked about that. When you were talking, we were saying something about the year of menopause. Somebody has put a question here that what do you have to say to news about a 60-year-old woman giving birth for the first time? I mean, you did say menopause period is between 45 to 51 now. So, this is the question.
Right. So I am not aware of that story, and I will be quite surprised if that was not an assisted conception. Okay. So I don't know who the person is, but it might be an assisted conception. Either she's preserved her ovaries, or she had to have ovary donation, because women, give birth to children in different ways now. It's not the normal man and wife thing. People go for sperm donation, IVF, ovary donation, surrogacy. So I really don't know what's behind the story of this 60-year-old woman, but I'll be quite surprised if this was something that happened naturally. But at the end of the day, in medicine, we never say never. There's nothing like never in medicine, because there will always be people who will be outliers or exceptional people. So yeah, so we
did hear about the stories of what's the Prophet Ibrahim, and that's a very typical example of the fact that it can actually happen. And I mean, if it's the blessings of Allah, the miracles of Allah, it can happen, and we should never lose hope of such things happening. But this is just talking about the actual process and what happens and what has been empirically researched and proved. So that's the basic. Of course, we will never rule out the possibility of miracles and all that. Now, the other question I wanted to ask, I wanted to make a relationship between, people talk about midlife crisis. You understand? And at the age, it looks to me like the age of menopause is somehow, around the same age where you have this midlife crisis. Do you suppose that for women, that might also be part of the trigger factor for midlife crisis?
Yes, I think during the course of the presentation, I must have dropped hints like that. Like this is the time when your career is becoming busy, or you're thinking, oh, actually, I'm done with childbearing now. I need to face my career. But then you take on so much, and then you're having this problem with your personal self. You've got problem with your home, or maybe, with everything going on in the UK or the world now, everyone is stressed about the situation of things. So you can't have too many things coming on at the same time. So yes, you are right. It can coincide with a time when women experience midlife crisis. And again, it's just recognizing what the problems are and identifying each one of them and trying to tackle them. At the end of the day, you cannot tackle everything. You can only do what you can. And some things you just have to resign and find coping strategies. So yeah, that's my take on that.
Yeah. Do we have anybody with questions? Please raise your hands, or if you would like to put your questions in the Q&A to ask Dr. Fauzia. And yes, in terms of I think it was Alhaji Atunrashi that said it about men having some kind of hormonal change at certain points also. Now, is there a way that medically that people can try to say, okay, we know we're moving towards that point in our lives that we're going to be having this kind of crisis? Can they have preemptive treatments to, like make sure, okay, the effect of menopause doesn't come so hard on them? Is that something that?
Are you talking about men? Is that
both
about
men and women? Both men and women.
Again, it's just creating this awareness and understanding your body and trying to take each day as it comes and being patient, because we must not forget that this body is Allah that gave it to us. And when Allah puts you in a situation, you just have to try and cope with it. You have to beg Allah to make it easy for you. You have to try and make it easy for yourself as well. And we have to support each other. I think that's really important. You can't reverse your age because these are all aging process. Your ovary is going to sleep, your testosterone has had enough, and when you actually look at, it's not just those ovaries. If you look at yourself as a whole human being, you start to slow down when you get to a certain age. The things that you can do when you were 40, which is the prime age, you find out about 45 already, you're struggling. You're struggling with your knees, with your ankle, you're struggling even with retaining things. The way we studied in secondary school, university, you dare not put yourself through that now. So it's a natural thing. And when we accept it as a natural thing, then it makes it easy for us to accept and start to find ways of dealing with it, because it's not likely going to get better. It's just going to progress. So preparing your mind and preparing yourselves with lifestyle changes, pace yourself, don't exert yourself, don't add stress to what is going on for yourself. And I think, inshallah, it's going to be easy if we beg Allah and do our own efforts.
Yeah, somebody's put a question here. Can any type of food help women go through menopause better? I mean, people have said if you eat a lot of almonds, for instance, it improves the. So that's the question. Is there any other types of food?
So I think there are studies that actually show that African women suffer less because yam contains a form of estrogen.
What? Yam?
Yam. Contains a form of estrogen, but I don't know how much yam you need to eat. But I think generally for us as Africans, we eat a lot of our food organic. We prepare our food from the scratch. So who knows, maybe some of those micronutrients also help us to cope better. Yeah. So the evening primrose oil is something that I think even the last sister seminar, one of our sisters actually gave a testimony and said that's what she used. And she actually went through menopause without blinking an eye. And as far as I'm aware, I've not heard of any side effects with some things as simple as that. So some people will say they take multivitamins. So I think it's mainly really eating healthy, because as much as yam has some estrogen, let's not forget that yam has a lot of starch as well. So we shouldn't start using yam to replace our estrogen.
And then we'll take care of one thing and then develop another thing.
Exactly.
Yeah, there is somebody's comments here from Alhaji Alabi say it gets better when spouses talk about it, than just changing attitudes. So I guess that's another very important reason we're having this conversation here today. I mean, there's nothing stopping, couples, as a result of this conversation and the things you have heard, to actually start off conversation. Maybe some of those things you've been noticing, it might be a way towards actually handling some of the crises you're presently having in your relationships, just for you to come to that realization that, it's actually possible. All this is all menopausal reactions, and then you face it and you have like real conversations around that. I guess, is there any further question? I think we can take 1 or 2 questions, and while we're at it, please, the donations, keep them coming. There's somebody's hand raised. Yeah, Alhaji Atunrashe, please go on.
Assalamu alaikum once more. Yeah, Jazakumullah for giving me another chance. Based on the advice given by our doctor, and also given life experience, I think couples should be more supportive of one another. But before you could be supportive of one another, looking at the baggage that we brought back home in terms of culture, you need to understand what doctor is saying tonight, both male and female. And as such, my view is, if you are going through something like this, it's best for you to contact your GP, who will give you all those advice necessary, just as our doctor has given us. And if you need to go for therapy in terms of talking therapy or anything around that kind of treatment, it is good that both of you attend and you understand one another much better. It will help to settle the home and allow the children to grow within the family environment. And we know that home breaking has got a lot of ill results, particularly, even though for male and female, but the children in particular. May Almighty Allah keep our family well and not allow any of us to suffer. Assalamu alaikum. Please see your GP.
Yeah, alaikum salam. Thank you very much for that very, very important intervention on this conversation. And I think it's something that we all should go, away with, think about, and actually act upon. I've got another Andre, Sister Mulikat, but while I'm going to call Sister Mulikat, please keep the donation coming. I'm still asking. I don't want to go away from this place with just 450. Please donate. Let's make sure we have this solved today. Sister Mulikat, if you go on, please. Is there a problem, Sister Mulikat?
Sorry, can you hear me?
Now we can.
Okay, so Assalamu alaikum warahmatullahi wabarakatuh. So I was just going to echo further what Alhaji Atunrashe has just said. It's very, very important for couples to communicate with regards menopause. And I think it's unfair if one spouse makes it difficult for the other one. People have come to talk to me about their husbands saying that they want to kill them when they have the fan on. The men do not want the fan. It's cold. Let's have conversations about it, because it's very, very, it can't have, and let's talk about it as a family with our children, so that children knows what mom is going through. It can be a bit embarrassing to talk about what dad is going through, but we can say that this has some emotional or psychological issue, because theirs is quite, we can't discuss that, but we need to talk about, mom is going through menopause, because then we have colleagues who will go through it. Then we have children, or even their sisters may come to go through it in the future. So it's very, very important to discuss this, because indeed, home are actually breaking as a result of this hormonal changes we are experiencing. And a lot of men have seen it as an opportunity to just go get another wife. Whilst polygamy itself is not haram, but sometimes there are some steps that we take, and the manner in which we take them destroys relationships further. And we need to think about our family as a holistic lot. So that's just what I wanted to put out there. We need to have more of these conversations. It would be nice if the people or the organizers of Who You Believe can bring together a panelist, so that we can understand what affects our mothers and our fathers And the children will be there so that we can discuss this more and have many questions answered, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you very much again, Dr. Fauzia.
And thank you for giving yourself a task before you go. Absolutely. You're one of the organizers of OU We Believe. So definitely you should start, planning to do exactly what you've said. And I'm sure we're all going to be supporting. I'm just going to put Imam Ajikonle on notice that you're going to be the one to give us the OU We Believe for today. I hope you're still with us. And when it's time, inshallah, I'll call you. Dr. Aderolu, thank you so much for this session today. It's been very, very enlightening, and you've raised very important points. And I do hope that we'll all go away with not just going away with this information, but actually trying to do something and making some kind of change in our family, in our lives, and the way we react and handle menopause and all its implications and everything. Thank you so much. And before we go, I just want to ask again, even if you don't donate now, you don't announce it, kindly make sure you send something into the Man UK account. The donation continue is very important. We need to get this mosque, and inshallah when we have the £500 dedicated fundraising event at Manchester, we do hope that you will try to publicize it, be there yourself, and also make sure that you call family and friends to donate towards the rebuild of the Old Kent Road Mosque. And since we don't have anybody for the financial update, I'll just hand over to, I'll call on Imam Ajikonle. I hope you're there for our OU We Believe today.
Alhamdulillah, Umar Ramadan. I must thank you for a job well done tonight. There was no vacuum whatsoever. So for that, I'm grateful to Almighty Allah that we have you. You took us to the women's world today, and it was quite an interesting journey. It's been so enlightening, just like I said. I'd like to echo. While all this was going on, one thing kept, going on through my mind, and I was like, Tabarakallahu Hasan al-Khaliqin. What an excellent God we have, who has perfected creation. He creates and he's able to repeat creation, and he has perfected everything. It tells us about how we were made in the best form possible, as well as Safilin. So disintegration starts happening at some points in our life, and one of them is the menopause we're talking about. So our whole you believe today will have to be something that I have to contextualize, because it's not just something that's general. If somebody is a libas to the other person, like Harmolika is to our spouse, and vice versa, we are a garment unto each other. So when one of the garments, is becoming, when we are going through these issues together, then we must be sure to provide the cover that is needed by the spouse. Our Ya Ayyuha Alladhina Amanu today will be Bismillah ar-Rahman ar-Rahim. Ya Ayyuha Alladhina Amanu Alaykum Anfusakum La Yadurrukum Man Dalla Ila Tadaytum. Your soul, Ya Ayyuha Alladhina Amanu Alaykum Anfusakum La Yadurrukum Man Dalla Ila Tadaytum. Look after yourself. Those who have believed, look after yourself. How to look after yourself when you know these signs are coming, like we now know better. When the time is approaching, be sure that you are prepared for that stage of your life, emotionally, physically, and otherwise, and take into account all the prescriptions by the doctor tonight. And I ask Almighty Allah that all our life, all stages of our life, we will live with good health and with Allah's rahmah. And I think that's all. And I think as short as that is, it has its own message. Allah says
It has absolutely the message we needed, and that is for us to take care of ourselves and prepare ourselves. And thank you very much for that. And I want to thank Professor Masood Badiri, even though he's not here today, for giving me the opportunity to stand in this very big shoe and talk before all you, my fathers and mothers. And I do hope that you will take me as I have done it. I'm sorry if there was any mistake, that's mine. And every other thing is because of the support of all you wonderful people. And on that note, I'll hand over to Mr. Olawale Hassan to sign us out.
Wa alaikum salam wa rahmatullahi wa barakatuh. Alhamdulillah, Amin. That is it for the special edition of OU Believe today, when we all look at an issue initially thought of as a women issue, but now we know we are all involved. I was wondering initially, how come it's men or pause and not women or pause? Now I think I know better. We pray Allah Azza wa Jalla to make living easy for all of us and make our life indeed a beneficial one for us and for everyone around us. Allahumma ameen. Let us keep the donations going on. As Ramadan said, she wouldn't want to be an apatemata. She's just halfway into it. Please let us donate. May Allah be pleased with all of us. Inshallah, next week, same time, we shall have the opportunity of looking at yet another topical issue as it affects our living as human beings and as well as believers. We pray Allah Azza wa Jalla to ease our tasks and be pleased with our efforts. I remain yours, Abdul Ghani Olawale Hassan. I say Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh.
West and West Midlands of England cordially invites you to the £500,000 fundraiser for the Old Kent Road Mosque Rebuild Project. Date, Sunday 4th of December 2022 at the Irish World Heritage Centre, 1 Irish Town Way, Cheetham Hill, Manchester, M80AE. Time, 12 noon to 4 p.m. Hosting organisations are Nasrullahi wal Fatul Islamic Centre, NGM, Manchester, Al Fatul Qareed Islamic Society of the UK, Manchester, Organisation of Ahbab al-Rasul, Manchester, Al Muhsinun Islamic Centre, Manchester, Salam Sisters, Manchester, Nimab Welfare Trust, Birmingham, Nigerian Muslim Association, NIMAC, Coventry, and Muslim Association of Nigeria, Man UK, Old Kent Road Mosque and Islamic Cultural Centre, London. Let's build a heritage. Partake in this meritorious act to build the house of Allah and secure your place in paradise. 12 noon on Sunday, 4th December 2022 at the Irish World Heritage Centre, 1 Irish Town Way, Cheetham Hill, Manchester, M80AE. Come and be blessed.
Just under 60 seconds, I'm going to tell you why investing in this opportunity will change your life. Are you ready? Start the clock. Over 20 years ago, a group of believers acquired a derelict pub slap bang in the centre of the Old Kent Road. As we've grown, so has our need for space. And we are embarking upon the journey of a lifetime to extend the good work of this masjid. And we need you to join us on this journey. Let me remind you of Allah's promise. Whoever builds a mosque for the sake of Allah, Allah will build for him a house in paradise. And it doesn't stop there. The masjid that we build will continue to give you rewards for as long as it remains standing, perhaps decades after you pass away. Think about all the people who attend the mosque to pray 5 times a day, every single day of the year. The Jummah service that is attended by hundreds of people, the hundreds of youngsters learning how to recite the Quran, and your fellow brothers and sisters breaking their fast in the month of Ramadan, right here in this masjid. Inshallah, you'll get a slice of the reward. All of these and more coming straight to your scale of good deeds. So what are you waiting for? Help us build this masjid.
Sponsor a prayer space and get your friends, neighbours and loved ones to sponsor one too. Or even better, get together and sponsor a whole saf.
And inshallah, watch how Allah elevates you in this life and the next.
يا أيها الذين آمنوا اتقوا الله وقولوا قولا سديدا يصلح لكم أعمالكم ويغفر لكم ذنوبكم ومن يطع الله ورسوله فقد فاز فوزا عظيما إنا عرضنا الأمانة على السماوات والأرض والجبال فأبين أن يحملنها وأشفقن منها وحملها الإنسان إنه كان